Hi, my name is Estefania Arizaga Arias, and my topic is exploring the relationship between emotional brain training, stress, depression, food addiction, and weight.
Obesity is a complex issue. Stress, depression, and food addiction are several psychological conditions that accompany an obesity diagnosis. Overweight and obesity are defined of normal or excessive fat accumulation that present a risk to health. A body mass index (BMI) over 25 is considered overweight, and over 30 is obese. The relationship between obesity and major depression has been evaluated throughout countless studies. Obesity were significantly more likely to be depressed than overweight and normal weight participants. Major depression was found in 50.5% obese compared to 8.2% in overweight and 7.4% in normal weight participants. Food addiction is a controversial topic argued by many researchers and professionals. Following some discovery, the Yale Food Addiction Scale was developed by researchers to evaluate food addiction in humans. The YFSS evaluation tool was created through the modification and criterion utilized in American Psychiatric Association Diagnostic Statistical Manual to Diagnostic Behavior, Addiction, and Substance Dependence. The following table illustrates the 7 basic substance dependence criteria established by the and utilized to grade the YFSS.
Today's topic is obesity. Obesity is a medical condition involving an abnormal or excessive fat accumulation that presents a negative effect on health. Obesity is defined as having a body mass index, or BMI, of 30 kilograms per square meter or more. The range 25 to 30 kilograms per square meter is defined as overweight. A body mass index is a measurement obtained by dividing a person's weight by the square of the person's height. Obesity is further evaluated in terms of fat distribution around the waist, or waist circumference. Men with a waist measurement of 94 centimeters or more, and women with a waist measurement of 80 centimeters or more, are more likely to develop obesity-related health problems. Obesity is a chronic medical condition that increases your risk of diseases and health problems, particularly certain types of cancer, cardiovascular diseases, type 2 diabetes, osteoarthritis, infertility, irregular periods, non-alcoholic fatty liver, and obstructive sleep apnea. Obesity can also affect your quality of life and lead to psychological problems such as depression, low self-esteem, shame, guilt, and social isolation.
Psychological disorder encompass a variety of conditions. Several of these conditions can result in a decreased quality of life. The Diagnostic and Statistical Manual of Mental Disorder proposes some examples of this psychological disorder includes binge eating disorder, bipolar and maniac depressive disorder, and panic disorder has recently been associated with obesity. Studies have also established an association between obesity and binge eating disorder. Medical equipment. For this case, you need a team of professionals that are integrated by nutritional doctor and psychiatrists.
Thanks, T, for this question. I'll start out by talking about what binge eating disorder is. It's not the same as bulimia, which involves eating large quantities of food and then using things to purge the food, such as over-exercising, vomiting, or using laxatives. Binge eating disorder is a newly defined disorder, and the criteria is as follows. Eating a massive amount of food in a short period of time, like over a couple of hours, and this would be more than what the average person would eat. While you're doing this, you feel out of control, like you just can't stop eating. So this is different from sitting down at a picnic and packing your stomach because the ribs are really good, or eating a lot at Thanksgiving. This eating behavior has to occur at least once a week for a period of 3 months. Also, while you're eating, you must have at least 3 of these 5 things going on. You can eat much faster than normal. You feel uncomfortably full. You eat large amounts of food even though you're not really hungry. You eat alone because you're ashamed of how much you're eating. And then, after you eat, you feel disgusted, depressed, or guilty. On a severity scale, binge eating disorder is considered mild if you have 1 to 2 binge eating episodes a week. It's moderate if it happens 4 to 5 times a week, severe if it's 8 to 13 times a week, and extreme if you have 14 or more binge eating episodes a week. But all you need is 1 episode a week for 3 months to be considered having the disorder.
Research has shown that as you gain weight to levels of overweight and obesity, your risk for the following condition also increase: coronary heart disease, diabetes, cancer, hypertension, dyslipidemia, stroke, insecurity, hopelessness, the rapid social change, the risk of violence, problems that affect physical health. According to the latest report from the Instituto Nacional de Estadística y Censo in Ecuador, 35.4% of the children aged 5 to 11 years old overweight and obese, and 62.8% of the adult population between 20 and 16 years presents obesity. Obesity is more than an aesthetic problem, as it presents carries serious health risks. The most advisable thing is that the young generation learn to prevent it. Treatment of the disorder is essential, based on a well-designed eating plan coupled with a regular physical activity program. Obesity is often accompanied by the depression, and one cause and influencer of the other depression can cause of the result from stress, which in turn can cause a change in your eating habits and activities. Inadvertently eating too much of the wrong food or giving up exercise, if not time, this becomes an habit that is difficult to change.
Weight gain is the sum of little things that add up over time. Choosing the escalator instead of the stairs, eating 2 helpings of dinner, and so on and so on. Ever wonder why you're winded or your joints ache and blame it on your age? Well, think about your weight. Imagine carrying a 10-pound bag everywhere you go. Just 10 pounds adds more than 30 pounds of force to your knees. So those achy knees might mean you need better habits. By realizing you're overweight, and by taking control now, you may lower the risk of developing serious health problems like heart disease, high blood pressure, type 2 diabetes, gallstones, and some cancers. Losing just 5% of your body weight may also decrease the stress you're putting on your body. That means doing more of the things you enjoy without the aches and pains. It's the little things that make up the weight gain. And it's the little things that will help take it back off. Wouldn't you like to drop the weight and stop picking up more? Obesity happens 1 pound at a time. So does preventing it.